this is Lori Hall, and today I'll be discussing home injuries that can occur in the homes of older adults. We will discuss ways to prevent these injuries. I am a current nursing student with Aspen University School of Nursing under the instruction of Professor Jeannie Randall in the class of Community Health 2. For the population ages 65 and older, the most common type of home injury results from falls. In the United States, every second an older adult suffers a fall. The second leading cause of injury in older adults are burns. Other very common injuries are home fires. Our objective of this discussion is to provide education to the population affected the most by home injuries, which is the older population of ages 65 and older. We would also like to prevent any future home injuries that may occur. To do this, we will provide resources for home assessments to see where the needs are in the home, and we will provide resources of who and how to contact someone in case an accident does occur. Other objectives include keeping the home generally safe for older adults and as it relates to each person's individual needs. We also want to keep that older adult independent in their home as long as possible. This may require some additional needs such as encouraging movement, physical therapy to help to maintain their mobility. This preventable problem of injuries in the home of older adults begin with us first defining what an older adult is. As I've mentioned already in this video, we're looking at a person who is of the age of 65 years or older. The injuries commonly occur are injuries in the bathroom where burns from hot water can happen. This is often due because the patient has sensory issues such as peripheral neuropathy where they're not feeling the water temperature and it is causing burns. So by the time they feel it, a severe burn has already occurred. Another issue is falls. Falls and slipping in the bathroom. This can happen just from simple loss of balance in the shower or the tub, or it could be from slipping in the soapy water in the shower and the tub, or it can be from those pesky throw rugs or throw floor mats where people can slip and lose their balance. Another issue is the toilet seat. Some patients can lose their balance as they sit on or get up from the toilet seat. Falls and burns in the kitchen can also commonly occur. This can be because the older adult is cooking wearing loose-fitting clothing or a gown. They would have loose sleeves, which when they're reaching over the stove could easily catch fire with gas stoves as well as electric stoves. Also, they may be moving a hot pot on the stove or cooking on a hot pot, and if it tips, they can get burned. Hot beverages such as coffee or tea heated in the microwave can fall on them, especially if it's over the stove microwave. Could easily slip out of their grasp and fall on them and cause a burn. Also, when heating up soups and that type of thing can also easily cause the burns in the older adult. Falls in the kitchen can occur from wet floors. The floors can get slippery from something simple as ice spilling and melting on the floor. That becomes a hazard. Any water getting on the floor can make it a hazard. And again, there's the throw mats, the floor mats that are very popular amongst the senior community. Those are also a slip or trip hazard. In other areas of the house, again, throw rugs and runners are very popular amongst our senior community, but they're also a big hazard. In the older adult population, fractures are a major complication, with 10% of falls causing a fracture. 2% of those falls are fractures involving the hip. This often results in a loss of independence. The older adult may have to leave their home and turn to care in a setting where they receive 24-hour care. The cost of these extended hospital stays or long-term care facilities are very costly and affect the patient and their families financially. Oftentimes these falls or these fractures result in surgeries or surgical treatments, and that again is more rehab, more time in the hospital, and more financial burden for the patient and their families. Prevention measures for falls would include installing handrails in showers and tubs. Using handrails that go around the toilet seat can also help prevent falls by the patient or the person having that extra support as they sit down and get up from the toilet seat. Also, having a raised toilet seat or raising the toilet seat makes it easier for the older adult who has limited mobility or mobility issues. Also, in the bathroom, having non-slip rugs will help to absorb any water that might get onto the floor. Make sure that they're secured to the floor so that that does not become an additional tripping hazard. You want to use something secured as opposed to a throw rug so that they won't trip and fall. In other areas of the house, to prevent falls, you want to declutter the home, which clutter is a tripping hazard. It makes the person not want to use their assistive devices because it's hard to maneuver around the clutter. This can be stacks of magazines or additional furniture, end tables, footstools. If the home is too cluttered, the person cannot get to their assistive devices easily or safely. There are also measures that can be taken to prevent burns. Setting water heaters to lower temperatures can help to protect older adults who suffer from neuropathy or any other, or even if it's not diagnosed, neuropathy. Keeping rooms well lit, especially the kitchen, can help prevent burn accidents. It can also help to prevent falls by allowing that older adult to better see where they're stepping and walking. Another measure to prevent burns is to install a smoke and carbon monoxide detector. This will help to save a senior in dealing with a house fire. Lastly, it's important to remove the sources of fire that can cause burns, such as lighters, cigarettes, candles, and gas stovetops. For resources for this community of older adults in keeping safe, the Center of Disease Control has a checklist available online. It covers all the safety information that we've covered today, and it gives additional information. And it's a list where they can check off to make sure that every issue in their home is addressed. There's also the Elder Care Directory. It also has resources which can assist with housing needs, nutritional assistance, Medicare and Medicaid benefits, which can be used to get home health or physician or services to get the home assessed by a home health nurse to see what safety needs are needed in the home, such as handrails in the bathroom or in the shower. Other resources available to the community are those that offer home modification grants or assistance. These grants will allow these updates of the home to make it safer or to add assistive devices. Also, the Department of Economic Security is a good resource, and their website is addressed here. The Senior The Administration for Senior Living also has resources for home modification to make the home safer. And the National Council on Aging offers education and resources for older adults and their caregivers, families, and healthcare professionals.